This is my client, Sherry, and this is her first visit, and we're keeping her face out of the camera view. And she came across my website somehow doing some search online some time ago, and it must have been more than 3.5 years ago, because at that time I was in Henderson, Nevada. And then more recently she came across my website again, or a video, and found out I had moved to Aurora. And so she lives about 20 minutes away and made an appointment to come see me. And I'm going to let her give kind of a brief synopsis of the last 20 years.
So I was a competitive gymnast, and I started having pain back then, but it was normal. Then I hurt myself in my 20s, and then I had 3 children, and continued with the SI pain and hip pain. And then in 2014, I saw a PT who diagnosed labral tears and bilateral FAI, and I saw
Which, for the audience,
sorry.
You want to explain FAI?
Femoral acetabular impingement, where the femur doesn't fit correctly into the hip socket, and they hit against each other and cause pain and labral tears. So I had bilateral hip surgery for the FAI and mixed impingements in 2014. And so my hips and labral tears are better-ish, but my SI pain and all of my other symptoms have remained. And so I am still chasing all of that pain and looking for answers.
And you've seen about a dozen physical therapists for that?
Yes, at least. Over the last 20 years, probably more.
Okay. And then after your hip surgery, how many therapists have you seen?
I've probably been to 4, maybe 5.
Okay. And you've seen other practitioners as well?
Yes.
A movement therapist and a chiropractor, or several?
Yes.
Injections, SI injections.
Yes.
So where are you right now? What's your current symptoms and your current frustration?
My SI joint and along my right vertebrae has always been very painful. I have pain wrapping around my right hip from the vertebrae across my SI to the front, and my pubic joint has always hurt. I shouldn't say always, for the last decade, and it's just another part of being normal.
Do you know what hurt the pubic joint?
No.
Wasn't a childbirth thing?
It could have been, but when it's mixed in with all the other pain, it probably hurt less than all the rest of the pain.
Got it.
I feel it now, but when so many different things hurt, you kind of don't know what to pay attention to first.
Sure. Okay. So you were aware of your foot and ankle not functioning normally, correct?
Yes.
And I don't think we can capture that on the camera. I wish I had a GoPro that I could get a better angle shot to compare the left and right ankle, but you do have some restrictions there. And what we found today was a restriction of the subtalar joint, the joint below the ankle, and tightness in your midfoot. And of course you've been told that you hyperpronate, and you hyperpronate in the forefoot, but it's the rear foot and the midfoot that supinate excessively. So I would label you as a supinator. So there's a little controversy there, right? Anyway, we want to make a correction where the motion's lost. Restoring movement, restoring some pronation in the subtalar and midfoot will actually reduce the hyperpronation in the forefoot. Were you aware of the hip lacking extension?
I have heard that before.
Okay.
But it hasn't been fixed, or I haven't been able to help it.
Sure.
And that, I think, was part of the lack of extension because of the bones not being able to move that way prior to surgery.
Okay, and how about after surgery?
I don't know that I've heard anybody say it after surgery.
Okay, all right. So now focusing on the pubic joint. Have you had the pubic joint evaluated?
No,
Why?
I don't know. I guess I've always focused on the hips.
Sure, sure.
And with all of the x-rays, I guess I just thought if anything else was wrong, if they could see it, then they would have said something, but maybe you can't see it on an x-ray.
Okay, and then how about the asymmetry of the pelvis?
Oh, I've heard multiple times that I'm off in different ways, tilted and one side higher than the other.
Okay, and they've tried to treat that?
Yes.
Have they taught you how to treat it yourself?
Sort of. It doesn't work.
Got it, okay, alrighty. And the other thing that I found was in the upper cervical spine. Were you aware of that tenderness up there?
Yes, I get migraines. Often sparked by something in my shoulder leading up to my head, and then if I'm really uneven or off,
Yes.
then my head really pays for it.
Very good. And good observation. So I think I'll stop filming here so we don't film too long.
Okay.
So we've covered a brief interview section, and then I'll show at least the restriction in the hip and the pubic asymmetry of the pelvis. We'll show that, and then we'll go ahead and treat it and teach you how to keep that.
Okay.
And I'm optimistic that we can make a difference. I don't know how much difference, but I think enough to be worthwhile.
Okay.
So thanks very much.
Thank you.
I'll be right back.